Hello and welcome. My name is Isabel Sofia Diepa, pronouns she, her, hers. I am the engagement reporter for the Fresno Education Lab. The Ed Lab, as we call it, includes 3 reporters and 1 editor. We work on reporting education stories in the Valley with a focus on educational attainment and solutions journalism. Today is the first day of the new school year for many Fresno students. COVID-19 has changed all of our lives. It has affected education for the past almost 2 years, and we are now learning to coexist with the virus while attempting to keep our communities healthy and safe. There are many questions on how schools can keep kids safe while also prioritizing learning. Our panelists today are Nikki Henry, Chief Communications Officer at Fresno Unified. And once again, we'd like to welcome back Dr. John Zweifler from the Fresno County Health Department. We ask you to submit your questions and concerns about going back to school today. If you're not able to submit your questions beforehand, do not worry. We will also be covering questions towards the end of today's show, so be sure to leave a comment in the comment section if you have a question. Today's discussion will be covering vaccinations, masks, and mental health. So without further ado, we're going to dive into our discussion. So to kick it off, I'm going to ask a question to Nikki Henry. Today is the first day of school. So how is it going?
It is going really, really well. I was out at several school sites this morning, and I have to tell you, the energy is just contagious. It's so exciting. Everyone's excited to be back in person. And I will say one thing that I love to see being at the school sites is all of our kids were showing up, and masks, as you know, are optional outdoors, but our kids are wearing masks outdoors. It is not as big of a deal to them as I think that we sometimes make it. They're happy to kind of follow those rules and try to be safe themselves. So everybody was excited and happy to get going. Of course, there are going to be kinks, but are so good.
Thank you. Thank you so much, Nikki. I'm glad to hear that things are going well. So kind of diving into some of the meat of our discussion. Yesterday, Governor Newsom announced a mandate on masks, speaking of masks. So we want to know, what are some of the logistical challenges of the governor's new teacher vaccine weekly testing mandate, as well as the mask mandate?
Yes. So Yes, thank you. The mask mandate has been in place for quite a while, right? And then understanding, that it was going to be continuing this year. So we dealt with that a bit as we were doing hybrid options for our students last year. Again, we don't have as many enforcement issues, I think, as some people might imagine, because it is such a big topic of conversation, more for adults, right? So handling that, we always have masks on hand if our kids forget them, things like that. But they've been, again, we have been dealing with this for over a year and a half. Our kids know how to wear masks. It's, they make it happen. Yesterday's announcement from the governor on the vaccine and testing mandate for our staff, we're still gathering all of the details to understand in depth how we implement this successfully. Just like with any other mandate, we are going to, figure out how to implement it successfully in our district. But we do have some time based on the governor's mandate to figure that out and implement it well. We have until October 15th to comply with that. So we're working as a cross-functional team to figure out how do we gather proof of vaccination, understanding what the requirements are there, and then also working to set up our capacity to be able to handle at least once a week testing for our staff who are unvaccinated or don't have proof of vaccination.
Thank you so much, Nikki. And I actually have a question that is both for you, Nikki, and for Dr. Zweifler. Is FUSD requiring students who can get vaccinated to get vaccinated? I know that kids 12 and over can get vaccinated. Will there be some sort of requirement for students who are eligible for the vaccine to get vaccinated?
We have no mandate at this time, and we don't plan on putting in that mandate as a school district. Again, we have a lot of other safety mitigations that are helpful in keeping the school environment safe. But of course, we are encouraging folks who are eligible to get the vaccine, because we know that that makes a difference in us coming out the other side and not having COVID kind of rule, our school environment.
Well, and just to build on that, so we have a various mitigation strategies. So just to back up, just to remind everyone, what we're dealing with is COVID, which is a virus. It's a respiratory virus. It's spread when you talk or sneeze or cough or play a musical instrument. And so the best way to make sure that you don't spread the virus is to either cover your mouth, like your mother probably told you, by wearing a mask, or by getting vaccinated. And also keeping in mind of what are the highest risk settings for viruses. We were talking beforehand about how Isabel used to get, if I shouldn't pass on too much information, about how she would get the flu when she was riding on public transportation. And so certainly that's an issue for all of us. But places that are crowded and indoors are where you're most likely to encounter viruses. And so when we're talking about schools, they check both those boxes. They're crowded and they're indoors. And so what strategies are left to us is masking and vaccination. I think one part of the confusion is we'd like to think that in black and white terms, and either it works or it doesn't work. Vaccinations are extremely effective, but they're not 100% effective. And as time goes on, we see different variants. The impact of the vaccines may be lessened. With masks, there's different types of masks, but if you use the types of masks that are recommended by this California Department of Public Health and Fresno County Department of Public Health, they're very effective in reducing the risk of transmission from one person to another.
Thank you so much, Dr. Zweifler. And you make a really great point. You guys both make really great points about the masks. And over the past week, the Education Lab has attended school board meetings at Clovis and Fresno, and there seems to be some confusion over the state's mandates, both the vaccine mandates as well as the mask mandates, and what authority do school districts have to not follow some of these mandates. And I was wondering if you both can give some explanation details and to understand why these mandates must be followed. Is it law? And what type of trouble could the district possibly get into if they don't follow these mandates that were put in place by the governor?
Well, I can speak to that to some degree. I'm a doctor and not an attorney, but the state of California, it has an obligation to protect the health and safety of its residents, and so there's various laws that govern that. The CDPH, California Department of Public Health, we abbreviate that CDPH, in its mandates, said that masking is required in schools. It's part of a more general face covering guidance, which has been modified largely because of the Delta variant, which is so much more contagious. So basically, at this point, they're saying they recommend that everyone, both vaccinated and unvaccinated, wear masks in indoor settings, but it's required in particularly high-risk settings. So public transportation, such as what we were talking about earlier, healthcare settings, and schools, also things like jails and other congregate settings where you have a lot of people in crowded indoor spaces. So in those settings, masks are mandatory. But what the CDPH also said is that it's up to the school districts to enforce that. And so I think that's where some of the confusion has come in. But the mandate is coming down from the state. We have courts to help sort out when there's questions about jurisdiction, and so we would certainly look to them. But speaking as a physician, a public health individual, to me, it makes all the sense in the world. Again, we're talking about crowded indoor settings. We want to get one thing. We were certainly very polarized around these issues. But I think one point that all of us can agree on is we want all of our kids to be back at school. We want to be able to offer in-person classroom instruction. So, and if you look at where we've come with this pandemic, where we were last year, where all kids were going to school virtually. So no one was in a crowded or indoor setting. Everyone was at home. To a set situation where we were physically distancing, and we say that 6 feet or more is considered physically distanced. And then that was reduced towards the end of last year down to 3 feet. And then this year, all distancing requirements have been removed by CDPH because the main priority is to make sure that every child who can go to school has a place. And so we've eliminated those distancing requirements that would help limit the opportunities for spread. And so then you think, okay, well, what else can we do with kids? Not all of them are eligible to get vaccinated. So the only other strategy we have right now is masks. So from a public health perspective, it makes all the sense in the world, especially in the face of the Delta variant, where we're seeing this, incredible surges, not only in California but around the country, to require masks when we're having kids and more crowded than they were last year. Let's see how they do. Let's start with the masks. Let's get through this the Delta variant surge, and then I think we can look at being much more selective in who needs masks and who doesn't.
And Nikki, did you want to speak on the district's behalf? Sorry.
Yeah. So agreed. I mean, I'm not an attorney, so I won't get into the legalities of it, but I'll say as a district, and speaking for Fresno Unified specifically, we really want to focus our energy on getting our kids back to school full-time in person, safely and happily. We know that our children and our students learn best in person at their schools. We know the social emotional benefits as well for our kids to be in school. So when we get these kind of mandates that come down, sure, is it logistically, we have to figure it out. We know that there are going to be folks who are happy and unhappy, on both sides of how they feel about the mandate. But really, as a school district, we want our energy on their education. And so we don't want to fight, mandates. We don't want to go to the courts. We don't want to spend a lot of energy and resources in that area when really that energy and resources can be focused on our students in their classrooms, focusing on what are the social emotional needs that they have, and also understanding where are they after a year plus of remote learning, and what work do we need to do to really make sure that they continue progressing in their educational journey.
Thank you for that, Nikki. And so I'm wondering, Nikki, if you could also answer this. What are the vaccination rates among teachers and teaching staff at Fresno Unified?
So because this hasn't been a mandate thus far, we have not required that people provide their proof of vaccination. So we really don't know the rates with clarity of where our teachers or our full staff is, for that matter. We definitely have encouraged it. We have made specific opportunities and private opportunities when this first came out, and when we were still tiered on who had access to the vaccine, to make sure that our staff had all the access in the world to make sure if they wanted to get it, they could. So we focused on that, but we have not required that people show proof of vaccine. So I don't have a number for you. Now with this mandate, of course, we will be getting that information as we start to implement the mandate.
Thank you. And Dr. Zweifler, do you happen to have the rates for teachers and teaching staff in Fresno County?
I don't have it for that particular subgroup. In general, about half of the eligible individuals in Fresno County have gotten fully vaccinated, and closer to 60% have had at least one shot. We do see in some groups where those rates are higher. So if you look at those who are over 65, those who are most likely to get ill, our highest risk individuals, the vaccination rates are over 80%. So, if our grandparents can get vaccinated, we should be able to get vaccinated. And we're protecting not only ourselves, but we're protecting our families and our community. So I would hope that all of us could emulate what our elderly residents have done.
And Dr. Z, giving those numbers on the vaccines that have been distributed, are there concerns of the spread of COVID-19 and the Delta variant now that children are returning to school 5 days a week, and the fact that children under 12 cannot get vaccinated?
Oh, absolutely. So again, going back to, what are our strategies for reducing the transmission of this respiratory virus? It's being outdoors, it's avoiding crowds, it's getting vaccinated, and it's wearing masks. So, when you're talking about kids in schools, it's indoors, it's crowded, they can't get vaccinated, so the only opportunity is masks. So absolutely, we're concerned. And the Delta variant, it's not clear that it makes you sicker. But it is clear that it's more easily transmissible. So studies have suggested that the viral load, the amount of viruses that you have in your body with the Delta variant, are about 1,000 times higher than they are with the original strain. So as a result, it's just much more contagious. So kids, it's inevitable that we will see cases. We already have. So. We can expect more cases and a continued surge. We've already seen the numbers of cases have gone up 5 times since where they were at the lowest point. Now, we don't necessarily expect the hospitalization rates and the deaths to follow quite as closely because, and again, this is a testament to the vaccines. The fact that our most vulnerable individuals are vaccinated, we are not going to see hospitalizations and deaths rise as much as they would otherwise. But having said that, we are seeing those hospitalization rates rise. And again, 3 or 4 times what they were. The deaths are more of a lagging indicator, but people will die. And what's unfortunate is it's, those are preventable deaths. So the vaccine is the way to go. But for kids, we don't have that as an option, the younger children. And so masking, again, it seems like what is required and again, makes so much sense.
And given that we are seeing a surge again, and I know the last time I sit in on the health department press meeting, they had said that there's a possibility that we're going to continue to see this surge until probably September, which then puts us into flu season. What is the possibility of school shutting down again? And what types of mitigations are not mitigations, but what's going to be put in place in order to transition if schools have to be shut down again and if kids have to go back to distance learning? This is for Nikki.
Okay. So we do have, procedures and protocols in place should there be, an increase in positive cases amongst our kids. So, but everything is going to be taken on a case-by-case basis as far as it comes to shutting down a classroom or shutting down a school. So previously, last year, there were kind of set metrics of, if you had what was considered an outbreak, so 2 in one classroom or 3 on a campus, then it was kind of an automatic shut down or go back to distance learning for that classroom or potentially that whole school. It's not black and white on that anymore. And so what we're looking at is when we have, what's considered an outbreak, so 2 positives in a class or 3 on a school site campus, then we're going to be working directly with the public health department, Fresno County Department of Public Health, to decide what's the best mode of action there. But of course, we're already getting ready for the fact that, there will be individual quarantines for, if students test positive or they're a close contact. So we've been working with our teachers. We've been working with our instructional department on, really a couple of different options of potentially simultaneous learning, potentially, independent study type of packets. What will be the best bet for each student, depending on where they're at in their education journey as well. So we're looking at all of that, but it's going to be a case-by-case basis on the larger idea of shutting down an entire classroom or shutting down a school site. And we're going to try to avoid it as much as we possibly can.
Thank you so much. Oh.
Yeah, I had a few comments about that one as well. So we talked about earlier, what is the main priority? It's making sure that kids are able to go back to in-person classroom instruction. So that's what CDPH wants. That's what Fresno County wants. That's what Fresno Unified. That's what our parents. That's really our point of emphasis. And one other change that CDPH put into place relates to what happens if you have a case and and those who are close contacts and what would happen. So. The definition of a close contact is someone who's within 6 feet for more than 15 minutes over a 24-hour period. So if you have a case in class and we've got everybody packed in, anyone within 6 feet of that child would then be considered a close contact, and normally would be said, okay, well, you need to stay at home until your quarantine ends. But what CDPH has done for this school year is to say, well, as long as everyone is masked, if both what we call the index case, the person who is sick, as well as those who are the close contacts, if both of those parties are wearing masks, then they can do what's called a modified quarantine. And in that situation, you can continue to go to school. You're expected to get tested, but you can remain in the classroom. And so it's really an effort to try and keep as many kids in the classroom. That's what we're really trying to emphasize, and again, why those masks are so important in really making sure that our schools keep going and that our kids can continue to participate in in-person classroom instruction. Having said that, I'm a doctor and not a lawyer. I'm also not an educator, but boy, I think it's really helpful having that option for the online instruction for people who do have to quarantine for whatever reason, who are sick themselves. Who have any number of challenges. That the in-person classroom instruction has so much value, but it's really important too that we do have that other option. And I'm glad that our schools can offer virtual education when necessary.
Thank you so much, Dr. Z. And actually, I'm really glad that you started talking about what the process looks like. Nikki, can you explain what the process would be for a student or teacher who tests positive? And does a whole classroom have to self-quarantine, or just the people who might be positive or people who are near them?
Yeah, so Dr. Z hit it on the head. So he really did a great job talking about the modified quarantine. So let's say that there's a student in a classroom who tests positive. Our nurses and our health services staff that are on site would work with the symptomatic student and, do the necessary work to get them, quarantined or isolated. And they would also clear them to come back when it's time. Testing is something that we'll be able to offer with parent consent. So again, that's the parent's choice if they want their symptomatic child tested. So we're working on that and making sure that everybody's up to speed to be able to do those tests. It's just the self swab. It's not, in your brain kind of deal. For our kids. So then we would look at the contact tracing. So we have a COVID action team here at the district who then would look at the contact tracing, who is considered a close contact, and what are the circumstances around that. So if they were masked, like Dr. Z had and they don't have symptoms, then they're able to stay in the classroom and we keep monitoring them to make sure that they don't develop symptoms. If they do, we treat them as the symptomatic child and again, do the process that we need to isolate and test as well. For our staff, if they test positive, it'll be the same contact tracing that's happening. Our COVID action team is on it. And we would, again, there's a modified quarantine for our adult staff as well, meaning if you're vaccinated and asymptomatic, then there's kind of a little bit of leeway there on what that quarantine or isolation looks like if you're a close contact. So again, there's a lot of nuances on each of them. And that's why we have to have a COVID action team. We have to have our health services staff up to speed on all of that so that we can treat each case individually based on the circumstances and really go from there. So we're doing our best. We're getting everybody up to speed as much as we can, and just going to follow those protocols to keep everyone as safe as possible.
Thank you so much, Nikki. The next question is a question that was submitted from the public. It is from B. Roberts. And B. Roberts asked, the reopening framework for K through 12 schools issued by the California Department of Public Health states that schools should arrange for eating outdoors as much as feasible. Has Fresno Unified directed schools, particularly elementary schools, where the vast majority of students are ineligible for COVID-19 vaccines, to have students eat lunch outside?
So as much as possible, yes. And so over the time of the pandemic, our facilities department has done everything in their power to try to create more outdoor seating, more areas and opportunities to do so. But we will have our cafeterias open as well. The thing is, obviously, knowing when you're eating and drinking that your mask does come off. So we're working to ensure as much distancing as possible in those instances. And also understanding our air quality, our heat and temperatures, the temperatures and weather once we get into more of the rainy season as well. So it's not always going to be an option, right? But we're doing the best that we can to, especially on those elementary grades, to stagger lunches so there's less people if we have to be indoors. And again, when the weather allows, we have a lot more seating outside for our students as well.
Thank you so much, Nikki. So we're going to move on to our next subhead. We've already started talking about masks because you can't talk about vaccines in school without masks. So this one is specifically on masking. So the first question is, how will schools enforce the masking requirements? How are they being enforced?
So we're treating masks as we would treat anything in our dress code. So meaning if there's, if a child's not wearing a mask, then we're coming at it from a position of support, not discipline. So reminders to, wear your mask, wear it properly, all of that. And then following kind of our level of intervention based on behaviors. So that we really have not seen those level of egregious type of defiance on masks. Like I said, our kids are used to wearing them. They're wearing them outside, even though it's optional to wear them outside. But if there is a major issue with a child not wearing a mask, then we follow our normal interventions where, again, it's supportive based, reminders, talking with the family as well if it's something that's a repeated behavior, and figuring out what's going to be the best mitigation for that child. Obviously, if there's a medical issue, for our students, then they can work through their primary care physician to get that medical exemption. And then we would work with them on what's that alternative to masking while they're indoors.
And just to clarify, even if a student has a medical exemption from wearing a mask, do they have to wear a face shield or some other type of protectant?
So I think Dr. Z can probably speak to that better, but yes, what we're understanding is that you want to try to find an alternative. So a face shield with a drape is possible. But again, there are situations where, some of our children might have specific medical needs that just are going to prevent for any sort of face covering. And so we definitely make sure that our teachers and staff that are working directly with children like that, who have that kind of medical exemption, that they have extra PPE as well to protect themselves and in turn protect the student as well.
Did you want to?
Yeah. Well, sure. So if CDPH has had a medical exemption in place since the beginning of the pandemic. They expanded on that recently and said it could be either medical, mental health, or disability exemption. After there were some questions about it, they specified that medical, mental health, or disability exemption determination needs to be made by a physician or nurse practitioner or a physician assistant or someone working with a physician, which I think is appropriate for a medical determination. The face shield and drape is not considered to be as protective. It doesn't keep all the aerosols and respiratory viruses within the mask as well as a mask does. So it's not an alternative, but if they're unable to wear a mask, then a face shield and a drape is our next choice. And as Nikki alluded to, so if you can't, if you, for whatever reason you can't wear either of them, again, that should be clearly stated by a licensed healthcare professional. Then you need to look at what are some other mitigation strategies. So you provide physical distancing. The other thing that happens is when individuals come to school, there's some screening that occurs. So are you having any symptoms of COVID? Have you been in contact with someone with COVID? So by screening for symptoms and for being a recent close contact, you again can reduce the chances of someone actually transmitting the virus in the class.
Thank you so much, Dr. Z. And Nikki, if you said that you guys were coming at this from a point of support versus discipline, if a student refuses to wear a mask and they do not have a medical exemption, what will happen to that student? Is there some sort of disciplinary action that will be taken?
It really is going to be on a case-by-case basis, where, if it's a repeated refusal to wear the mask, then we would bring in the family to really talk about what's going on there. What's the why behind the student having, such a problem keeping the mask on or any of that. So really trying to understand on a case-by-case basis the why behind that. And if it's not a fit for the child to wear a mask on a regular basis as is required indoors, then we would talk with the family about potential e-learn options. And if that might be a better fit for those students as well. But again, we're not looking at this. We want to be clear, this isn't you took your mask down in class and you're going to get suspended. That's not where we're coming at with this. We really do not want this to be kind of rule with an iron fist. We want to look at it from a supportive base and figure out how we can keep everyone safe and also support our families.
Thank you. And kind of shifting gears more on the disinfecting and keeping kids safe, what type of disinfecting protocols will happen in between classes and on the playgrounds?
Absolutely. So we are disinfecting daily as we always would, and of course, throughout the pandemic, we've increased and ensured that we have the right disinfectants and everything at the level that it needs to be to specific back COVID-19. We have increased ventilation. We've upgraded a lot of our systems to ensure that, our classrooms are as safe as they possibly can be, knowing that, again, they are indoors and there isn't 6 feet of physical distancing when you have a full classroom of kids. So we've done a lot to make sure that everything is disinfected well. Again, that'll happen daily, kind of that deep disinfection. But also our teachers are, going to be keeping up in their classrooms as much as they feel comfortable and they have the time to. And then we are specifically working in additional times for our classrooms to take time to wash their hands. Increased hand hygiene, we know, is huge for slowing the spread of that infection. So just making those opportunities for our classrooms and kids to wash their hands, keep their masks on, and having the supplies available to disinfect throughout the day.
And that's one area that we've learned more about the virus as time has gone on. And initially there was a lot of concern about transmission through contact, and there is less concern about that now. So you may remember when people were washing their fruits and vegetables and their groceries and things like that. And we just have not seen much transmission that way. Again, it's a respiratory virus. It's spread when you're talking, coughing, sneezing. So, it's possible that you can get the saliva and fluid on your hands and transmit it that way. But again, it's a very low likelihood. So now the recommendation is to just as Nikki was saying, to clean on a daily basis, particularly those areas that are high use, high contact. But there's less emphasis on having to disinfect on a frequent basis.
Thank you. And Speaking of, I want to shift into to outdoor activities because I know that when kids are outdoors, they are not required to wear masks. But are masks required for sports, for children who are playing sports and while attending sporting events? When some sports are contact sports, what type of protocols are put in place there?
Okay,
So
so it's
again,
kind of
masks. Oh, sorry. Go ahead.
go. Well, I was just going to say it's a complicated area, but the general guidance is if you're less than 6 feet apart, if you cannot maintain physical distancing, then you should be wearing a mask while you're outdoors. So, and also if it's a very high exertion activity, then you may not, then you shouldn't be wearing a mask. But as far as like individuals who are the audience who are observing any school activity, the mask mandate extends to all school activities. So if you're at a school event, you're expected to wear a mask, whether that's indoors or outdoors.
So, just speaking from the district again, the outdoor sports masks are optional. Of course, we know that especially if there's not physical distancing, we're going to encourage masks, but it's not a mandate for that. For our indoor sports, we are asking that our students, when they're on the bench or they're not in that high exertion, they would put their mask back on for any of those indoor sports, to keep in mind for that. And then, of course, indoor, it is required that any of our spectators would wear their mask. So it's really the indoor-outdoor piece of it, optional outside, indoor required. Indoor when you are playing the sport, so you're in basketball or whatever it might be, you're not going to be wearing it while you're playing, but when you sit back down on the bench, we are asking that our athletes put those masks back on.
Thank you so much, Nikki. And I'm actually going to pivot into another question from the public. This one's from James Renwick, and I'm going to direct it to Nikki. How will the FDPH monitor that masks are both being worn and being worn correctly by teachers and administrators, and what will the penalties be if they're not complying with the mandate? So we're going to start with Nikki, and then we're going to go to Dr. Z.
Yeah, so similar to what I was sharing before, again, we're going to try to be supportive. We'll treat it like we would a dress code violation, again, reminders and support to wear that mask and wear it correctly as well. Same goes with our staff, of course. We are requiring that of our staff to wear them correctly and wear them all the time indoors. So we'll be reminding them. And again, when we're looking at a repeated pattern of behavior or refusal or something egregious, then we would go through our normal processes, whether that be HR for staff or with our behavior interventionists or interventions at the school site for our students.
And as far as enforcement, so again, the CDPH said that they established the rules around masking, but they left it to the school districts to enforce it. And so as far as the Fresno County Department of Public Health our approach is of course the same.
Thank you. And I have another public question. This one's from Taylor Watanbi. My child isn't 3 feet apart from other children in their classroom because of the desks available, double desks, and the space available within the classroom. They are spread out to some extent, but for sure not 3 feet apart. How concerned should I be? Nikki, how concerned should this parent be about how far away their child is from other children?
Yeah, I'll let Dr. Z speak to, the concern specifically on health. And, of course, we know that when we're closer, that we have more chance of the aerosols from an infected person getting to us. So, we're trying to provide as much space as possible. But again, those physical distancing requirements and mandates have been lifted so that we could invite all of our students back. There's just no capacity for students to be back completely 100% of students to be back and to provide 3 or 6 feet of spacing. So it is one of those decisions that our parents have to make. Am I comfortable knowing that, yes, masks will be worn, and so that's a layer of mitigation, but that physical distancing layer of mitigation isn't there when we're inside the classroom. So it's one of those points that as a parent, you have to sit with your family and sit with what your risk, tolerance is for that, and decide what's best for your student and family specifically.
Yeah, I think it raises a really important point that we would like to have really clear-cut answers that this is what you do, this is what you don't do, and yet we're going to make value judgments. We make a value judgment when we get in an airplane, and we want to visit our relatives, but there's a chance that airplane will crash. So you're balancing things, and in this situation, yes, we're indoors, we're crowded, but we really think it's a very high priority for kids to be back in classrooms. So we take a deep breath and we do what we can, which again is why that masking is so important, and for as many people as possible who are eligible to get vaccinated. So we can return to more of a sense of normalcy.
Thank you so much for clarifying that, guys. And I want to move on. We've talked a lot about masking and about physical health, but mental health is just as important. And after a year and a half of distance learning, we have seen that we have heard and we've seen the statistics and the data of this has taken a mental health toll on a lot of our students. So diving right in, this is a question for both of you, but I would love for Nikki to start. What are the biggest concerns when it comes to mental health in students that the district has?
Yeah, so we know over the last year and a half, we've all kind of gone through some trauma with the isolation that's come with COVID-19, understanding that, the home environment might not be, a safe place for some of our students, right? And understanding that there is trauma, there is, potential abuse. There are a lot of things that our students have gone through over the past year and a half, just being isolated and being at home as much as they have been. So, on top of that, the trauma of potentially, our students who have lost family members to COVID, who have, seen any kind of loss through this pandemic. So we're keeping an eye on that, absolutely. And, and I can share a little bit more. I'm sure you have more questions, but we have absolutely increased our social emotional supports through hiring more staff, psychologists, social workers, different behavior interventionists, lots of different positions that we've increased, but we've also invested in social emotional curriculum for all of our teachers, additional professional learning, as well as some different services that are available for free to our students and families through Care Solace to get connected directly with a mental health professional, and working as a strong partner with the Fresno County Suicide Collaborative as well, making sure that we are trained and that we are a strong partner in identifying and responding effectively and efficiently to any of our students who might be at a place where they're thinking of self-harm.
Thank you, Nikki. Dr. Z?
Well, Nikki covered it very well, and I know the schools have invested a lot when working with the Department of Behavioral Health to ensure that there is access to behavioral health and mental health services for all of our students. And I think for all of us, it's so important to have interaction and to have that interpersonal stimulation that kids can now get while at school. So, that's why we're really pushing the in-person classroom instruction, and why we prioritize that even at the increased risk of having some cases in transmission. So we sometimes you have to make difficult decisions, and it's not that not everything always adds up in the same direction. So you have to decide what are your priorities, and in this case, it was ensuring that kids have access to more of an in-person opportunity. I think outweighs the potential increased risks associated with that, assuming we're doing the other things such as wearing masks and following all of our other protocols.
Thank you. And Nikki, you kind of started talking about, you said you guys had increased your the social emotional resources available. And I wanted to get into the details of what types of resources are available for FUSD students and how can they access that?
Yeah, so on campus, you're going to have what actually we're doing this year is wellness hubs on our campuses. So that's really a place where it's kind of a cross-departmental team that's come together as a family wellness center at the school site, where our welfare attendance or our child welfare and attendance specialists, our clinical social worker, our clinical psychologist, as well as our nursing staff are working together. So that physical and mental health, they're working completely together. And so our teachers, our parents, our students, any school site staff, anyone really can go online to our website and make a referral for themselves or someone else that they think might be struggling. And those referrals then come to these cross-departmental teams that are able to respond and assess and provide services for the student and their family, for that matter. So we've really come together and figured out how to streamline processes and make it easier for our students to access. But we've also increased a lot of the different resources that are available. So I mentioned Care Solace. That's something that's free and available to all of our families and all of our students. You can access online and get connected with, mental health professionals for that, for lots of different issues. And then we also are doing a couple more pilots as well. We're doing a pilot with Talkspace, which is a national partner. Michael Phelps, Demi Lovato, lots of high, celebrity kind of focused people who have used this service, where you're able to have unlimited 24/7 text, voice, and video messaging with a licensed therapist. And so we're providing that access to all of our freshmen and all of our students who are ages 13 plus at our specialty and alternative education sites, to really pilot if that's something that's going to be of a supportive resource to our students as they come back. And then you can do video appointments through that as well with a dedicated therapist. So it's not like it's someone new every time that you text or you send a video message. So we have that. And we also have a couple, other pilots going on. Like I said, the Talkspace, as well as our interdisciplinary team with that family wellness center. We also had shared last year, especially during remote learning, that we have a partner called Gaggle, which is able to alert us and let us know if a student is writing anything in Microsoft Teams or in their email or something like that, that would say they want or others. And that gets a 24-hour alert directly to our 24/7 mental health team at the district, that we're able to respond in real time as well.
Thank you so much.
Really, it's talk to your teachers, go online to the website, talk to your principals. Any trusted adult on campus or through our website, you can get access to those resources.
And there's mental health and behavioral health resources throughout Fresno County, just not in the state of California has provided some support through what's called the Safe School for All program. And as part of that effort, we're putting together a dashboard that will provide links to the behavioral health resources for all of the school districts within Fresno County. So, fortunately, I think Fresno County has worked very close. There's been very close collaboration all through this process with the schools, so that we've been able to really coordinate our efforts around some of the things that were brought up earlier, such as quarantining and isolation, things like that, but also in terms of ensuring that the behavioral health services are available throughout the county.
Thank you so much. And actually, I'm really glad that you both have brought up the services available. We have also, there's been an uptick in students experiencing depression and self-harm, according to multiple statewide reports. Dr. Z, I would like to direct this question to you first and then to Nikki. How is the Fresno County Health Department and school districts working to be aware of possible student self-harm and giving students the help that they need?
Well, the schools are one of the best places to identify those issues. And so that's another reason why returning to school is so helpful, where you can get a chance to actually interact with those kids and identify where those issues are. If everyone's at home, it's really hard to identify them. So I think that's another very important point. And the Fresno County is a very big county, so it's hard to reach everyone. So one of the emphasis is on providing telehealth services for behavioral health professionals, again, throughout Fresno County. So there's a lot of smaller districts that don't have as ready access, but by through our Department of Behavioral Health, providing telehealth services to every district is something that's happening right now through what's called the All for You program.
And Nikki, would you like to also address?
Yeah, absolutely. So some of the pieces that I mentioned earlier, speak to, again, Gaggle helps us on a digital platform to identify if our students are feeling like they want to harm themselves or others. But our staff are trained, especially our school psychologists and our social workers are trained specifically to identify and respond to any thoughts of self-harm within our students. And so we actually have a new social work position now this year that's completely dedicated to working with our students who maybe were recently released from hospitalization due to, ideation or an attempt on self-harm. So we're making sure that we have the people resources, we're making sure that we have the training, and then continuing to go to the level of the classroom, the teachers. So maybe it's not the clinical social worker that's there, but making sure that our teachers have access to social emotional curriculum and have access to professional learning that helps them to better identify and respond to their students who might be struggling with depression, anxiety, and thoughts of self-harm.
Thank you. And this question, my last question, what message do you think people are hearing? What question do you think that is happening that you think that you are hearing often, but we are not talking about?
Okay, well, one we can talk about is sports. The whole issue of outdoors, and so in general, outdoors is so much safer because there's so much room for the virus to dissipate as opposed to indoor setting where it's kind of trapped. So really, outdoors is such a safer environment. So for our sports that are outdoors, you're in a lot better place. But at the same time, some of those sports are involve a lot of contact, so they're high risk. So you think about football and sports like that, and so last year there was guidance on that, and you look at kind of if you follow college sports or the pros, that they're doing frequent testing. For K through 12, the high schools, the requirement was not as rigorous, but there was still testing required for high risk, high contact sports. We haven't gotten guidance yet from the state on that. And I think it just reflects this, you're having to do this balance of, we want to get back to some sense of normalcy. We don't want to create high bars to participate in activities. On the other hand, we want to stay safe. And so some type of routine testing for those who are not vaccinated, I think is a safe place to start for those higher risk sports where contact is involved.
I think for the district, of course, talking about safety guidelines, masking, vaccination, I know this is on people's minds and hearts, and so we want to respond to that. But we also know that our core mission, we're an education institution, and so we need to be focused on the education of our children and progressing in their learning. And so I think really, speaking to a lot of our parents who are concerned about maybe feeling like their kids lost a year of learning over, remote learning, things like that, and what we're doing to support them. So we have increased so many supports for the educational side of our school environment. We're not just focused on, the safety piece of it and the health piece of it. It's all important. But really, what we do best is teach our children and to help them grow. And so we have assessments in place to really assess where our kids are, to understand how we can individualize their learning plans and their instruction for where they are. And our teachers are just so talented. Like, really, our teachers, they know what they're doing. They love your children. They're going to work so hard to make sure that our kids get what they need to continue learning and growing. So we've got the assessments, we've got the supports, we've got the additional resources. And I just want to share, I know that Fresno Unified, we get beat up because we aren't at the place that we want to be on, let's say, specific test scores and things like that. And that's important. I mean, we talk about that every single day, but we're moving towards and we are progressing every year. So you talk about, NAEP scores or SBAC scores. Our kids have been progressing and moving to more proficiency every single year for years and years now in our district. So we have been working on it. We will continue to work on it. And we are seeing the progress. Are we where we want to be? No. But we are on the right track and we're moving in the right direction on behalf of our kids, and especially on behalf of our kids who have seen the biggest disproportionate gaps in their learning, right? So our foster youth, our homeless youth, our African American students, our students with disabilities, our English learner students, we are investing more and more resources and targeting our highest need students regularly. And they are moving in the right direction. So trust us, we're here. We love our kids. We're going to make sure that their learning is high quality and that our kids are moving forward as we all expect them to.
And I would just say, in terms of moving in the right direction, I think the same applies to what's going on with the pandemic and with schools particularly. And you look at it as a continuum where virtual to in the classroom, and now more and more kids in the classroom to where there's no spacing. If you look at it from that perspective, the masking again, I think that's the one that's been on most people's mind. It just makes so much sense as we bring more kids into the classroom, a more crowded setting. Let's keep the mask on as we go through that process, as we get through this surge, and then for sure we can think about relaxing that one. But to do several things at once and in the midst of a surge, it doesn't. I don't think it makes sense from a public health perspective. So I'm excited that our kids are coming back, and all kids have a chance to come back to school and do it in a safe manner.
Thank you so much. And that is going to be the end of our live. Thank you so much, Nikki and Dr. Z, for coming on and talking with us. I feel like we clarified a lot of questions that we have been hearing and that the community also wanted to have answered. If you did not get a chance to submit your question, you could also email us. You can email me at edlab@fresnob.com or my email, idiepa@fresnob.com. Thank you so much to our panelists again. This has been super insightful. Thank you for tuning in. And if you want to learn more about how to donate and to support our work, please visit fresnob.com/edlab. And you could also be sure to find me on social media. My Twitter handle is Isabel S. Diepa, and you could also follow the Fresno Bee at Fresno Bee. Thanks so much, everyone. Have a great afternoon.